about tuning fork assessment is that emerging research is showing that tuning fork assessment will catch loss of protective sensation earlier than monofilament testing. That's the big take home. So a patient may have 10 out of 10 monofilament testing, have no absent sensation with monofilament testing, but have impaired sensation as tested by vibratory testing using the tuning fork. And the studies show that those patients who test fine on monofilament and are impaired for tuning fork are at 15 times greater risk of developing a pressure ulcer. So to me, the take home is do the tuning fork. Clinically speaking, since this is newer information, you guys know how it goes. Bless you, it just takes a while for that information to disseminate to the clinic and for us grumpy clinicians to make behavior change. So you will see monofilament testing out there. It's just a conversation to have with your clinicians or your employer, your coworkers, and also doing tuning fork. So if I was to do this in the clinic, I would just always start with tuning fork, because if their vibratory sensation testing is fine with tuning fork assessment, then they're good to go. If this is impaired, then monofilament testing is also likely impaired. Okay? So for tuning fork assessment, you need to hold the base of the tuning fork with 2 fingers. For those of you who grip strength might be something that you want to focus on, you can stack your middle finger on top of your index finger just to give a little bit more pressure, a little more force, but you just really can't get a good hand grip on it. You also need to make sure that your fingers are way down low and not up here by the tines, because it's going to dampen the vibration. So you hold it down low, give it a good whack. If you don't hear the clang, you didn't do it hard enough. Okay? I hit it on the palm of my hand. It doesn't feel great, but it's also a one-time thing. I'd rather you not hit it on the plinths, because it just bangs out the plinths. Did Dr. Sykes teach y'all about wrapping your tables? Dr. Sykes would not like us hitting the table. Okay, so you do your clang, and then as soon as you do that, then you put it directly on the testing site. So for protective sensation, as tested by the tuning fork, it's on the great toe between the joint and the nail bed. So I'm going to show you on my thumb. It's proximal to the nail bed and distal to the joint. So it's just that skin space where your toe hair starts growing. Right there. So if I were doing it, if my great toe is my thumb, I would hit it and get it there really quickly. And try to hold it still. Because if you're shaking the tuning fork, then your patient isn't going to get good information, accurate information. Okay? Cutoff scores. This is in your PowerPoint as well. So if your patient, these are the instructions. Ms. Jones, I'm going to use this tuning fork to assess your ability to feel protective sensation. It's a vibration that you're going to feel. Your job is to tell me when you stop feeling the vibration, as soon as you stop feeling it. You don't ask them to tell you when it starts fading down. It's just tell me when you no longer feel the vibration. So you count. If you want to mess with using a stopwatch, you can. I'm not going to say no, but 1001, 1002, 1003, that's totally appropriate. So if a patient feels this vibration for 4 seconds or less, they have profound impairments. For those patients, the research shows that 50% of them are going to pass the monofilament testing. So that's a reason why it's important to pay attention to tuning fork, because They may test fine on the monofilament, but their protective sensation is still poor. And there's 15% greater likelihood of developing a pressure ulcer if their tuning fork assessment is absent, or impaired rather. So 4 seconds or less, profoundly impaired, severely impaired. Between 5 and 17 seconds, it's mildly impaired or moderately impaired. Those patients will likely pass the monofilament testing. So it's just something to pay attention to. 18 seconds or greater is normal. So 4 or less is profoundly impaired. That middle range, and they have 50% likelihood of not feeling, of passing the monofilament testing. 5 to 17 is, does anybody have that thing pulled up? I want to make sure I'm telling you accurately if it's moderate or mild. I need to get that word in. The term is intermediate neuropathy. So severe neuropathy is 4 seconds or less. They have impairments to protective sensation, 50% chance of monofilament testing being normal. 5 to 17 seconds for the tuning fork, intermediate neuropathy, impaired protective sensation. Monofilament testing will likely be normal. 18 seconds or greater, no impairment. Monofilament testing is not indicated if it's 18 seconds or greater. Okay, so claying, put it right on there. It doesn't matter if your patient is watching it really, because once the vibration is going really slow, you're not really going to be able to see it vibrating, but they will feel it vibrating. Okay, questions about tuning fork? Okay, monofilament testing